The human heart is a vital organ responsible for pumping blood throughout the body, supplying oxygen and nutrients to various tissues and organs. It is a muscular organ located in the chest, slightly to the left of the midline. The anatomy of the heart can be divided into several key components. Chambers. The heart has 4 chambers, 2 atria, singular, atrium, and 2 ventricles. The right atrium receives deoxygenated blood from the body, while the left atrium receives oxygenated blood from the lungs. The right ventricle pumps deoxygenated blood to the lungs for oxygenation, and the left ventricle pumps oxygenated blood to the rest of the body. Valves. Valves within the heart maintain the unidirectional flow of blood. There are 4 major heart valves. Tricuspid valve, located between the right atrium and right ventricle. Pulmonary valve, located between the right ventricle and the pulmonary artery. Mitral valve, bicuspid valve located between the left atrium and left ventricle. Aortic valve, located between the left ventricle and the aorta. Blood vessels. The heart is connected to a network of blood vessels that transport blood to and from the heart. The major blood vessels include aorta, the main artery that carries oxygenated blood from the left ventricle to the rest of the body. Pulmonary arteries, these carry deoxygenated blood from the right ventricle to the lungs for oxygenation. Pulmonary veins, these bring oxygenated blood from the lungs to the left atrium. Superior and inferior vena cava, these veins return deoxygenated blood from the upper and lower body to the right atrium. Septum. The heart is divided into 2 halves by a muscular wall called the septum. The interatrial septum separates the 2 atria, and the interventricular septum separates the 2 ventricles. This separation ensures that oxygenated and deoxygenated blood do not mix. Coronary arteries. These are small blood vessels that supply the heart muscle itself with oxygen and nutrients. They branch off from the aorta and wrap around the heart. Pericardium. The heart is enclosed in a double-walled sac called the pericardium. The outer layer is the fibrous pericardium, while the inner layer is the serous pericardium. The space between the 2 layers contains a lubricating fluid that reduces friction as the heart beats. Heart wall. The heart wall consists of 3 layers. Endocardium, the innermost layer that lines the chambers of the heart. Myocardium, the thick, muscular middle layer responsible for the heart's pumping action. Epicardium, the outermost layer that covers the surface of the heart. The coordinated contraction and relaxation of the heart chambers, along with the opening and closing of valves, allow the heart to pump blood efficiently, maintaining the circulation necessary for sustaining life. Any disruption in the structure or function of the heart can lead to various cardiac conditions and health issues. Details about the anatomy of the heart. Atria. Atria. The atria are the 2 upper cavities of the heart. The right atrium receives venous blood, low in oxygen, from the superior and inferior vena cava, as well as the coronary sinus. The left atrium receives arterial blood, rich in oxygen, from the pulmonary veins. Ventricles. The ventricles are the 2 lower cavities of the heart. The right ventricle pumps blood to the lungs through the pulmonary artery. The left ventricle is responsible for pumping oxygenated blood to the rest of the body through the aorta. Heart valves. Heart valves ensure that blood flows in only one direction. The tricuspid valve separates the right atrium from the right ventricle. The pulmonary valve is located between the right ventricle and the pulmonary artery. The mitral, or bivalvular, valve separates the left atrium from the left ventricle. The aortic valve is located between the left ventricle and the aorta. 4. Coronary circulation. The coronary arteries are responsible for supplying blood to the heart muscle, myocardium. The right coronary artery and the left coronary artery, which divides into the anterior descending artery and the circumflex artery, are the main coronary arteries. 5. Cardiac electrophysiology. The heart has its own electrical conduction system that regulates the rhythm of the heartbeat. The sinoatrial SA node generates electrical impulses that initiate heart contractions. The atrioventricular AV node delays the propagation of impulses, allowing the atria to contract before the ventricles. The bundle of His and Purkinje fibers conduct electrical impulses to the ventricles, triggering their contractions. 6. Pericardium. The pericardium is a double sac membrane that surrounds the heart. The parietal pericardium is the outer layer that lines the pericardial cavity. The visceral pericardium, or epicardium, is the inner layer that is in direct contact with the heart muscle. Cardiac function. The cardiac cycle involves systole, contraction, and diastole, relaxation, of the heart chambers. During ventricular systole, blood is pumped out of the ventricles to the lungs and body. During diastole, the heart chambers fill with blood for the next cycle. Eustachian valve, it is a small valve located in the right atrium of the heart that regulates the flow of blood from the coronary sinus to the right atrium. Cardiac tissue, the myocardium is the cardiac muscle responsible for the contractions of the heart. It is thicker in the ventricles than in the atria due to the greater force required to pump blood around the body. Understanding the anatomy of the heart is critical to understanding how it works and how various heart conditions can affect your health. The heart is a complex and crucial organ for blood circulation and, therefore, for human life. Let's delve even deeper into the anatomy of the heart. Atria. The atria are the two upper chambers of the heart. The right atrium has a thinner wall and receives venous, low oxygen, blood from the superior and inferior vena cava and the coronary sinus. The left atrium also has a thinner wall, as it receives arterial blood, rich in oxygen, from the four pulmonary veins, which drain oxygenated blood from the lungs. Ventricles. The ventricles are the two lower cavities of the heart. The right ventricle has a thinner wall compared to the left ventricle and is responsible for pumping blood to the lungs through the pulmonary artery. The left ventricle has a much thicker wall, as it needs to pump blood throughout the body through the aorta, providing much greater pressure. Heart valves. Heart valves are important structures that ensure unidirectional blood flow. The tricuspid valve separates the right atrium from the right ventricle. The pulmonary valve is located between the right ventricle and the pulmonary artery. The mitral, or bivalvular, valve separates the left atrium from the left ventricle. The aortic valve is located between the left ventricle and the aorta. Coronary circulation ****. The coronary arteries supply blood to the heart muscle itself, the myocardium. The right coronary artery, RCA, and the left coronary artery, LCA, are the main coronary arteries. The RCA mainly supplies the right part of the heart and part of the interventricular septum. The ACE is divided into two main branches, the anterior descending artery, LAD, which supplies most of the left ventricle, and the circumflex artery, ACX, which supplies part of the left atrium and left ventricle. Cardiac electrophysiology. The heart's electrical conduction system is essential for regulating heart rhythm. The sinoatrial SA node is the heart's pacemaker and generates regular electrical impulses that initiate heart contractions. The atrioventricular AV node delays the propagation of electrical impulses, allowing the atria to contract before the ventricles. The bundle of His and Purkinje fibers conduct electrical impulses quickly to the ventricles, triggering their contractions. Pericardium. The pericardium is a double-sac serous membrane that surrounds the heart. The parietal pericardium is the outer layer that lines the pericardial cavity. The visceral pericardium, or epicardium, is the inner layer that is in direct contact with the myocardium. Cardiac function. The cardiac cycle is divided into systole, contraction, and diastole, relaxation, of the heart chambers. During ventricular systole, blood is ejected from the ventricles into the blood vessels. During diastole, the heart chambers fill with blood for the next cycle. Other structures. The atrioventricular AV node is located in the wall of the right atrium, close to the interatrial septum, and is responsible for delaying the conduction of the electrical impulse, allowing the coordinated contraction of the heart. The papillary muscles are located in the ventricles and are connected to the atrioventricular valves, tricuspid and mitral, through chordae tendineae. They help keep the valves closed during systole. This more detailed description of the anatomy of the heart provides a deeper understanding of the structures and functions of the essential organ that maintains blood circulation in our body. Accurate knowledge of cardiac anatomy is critical to understanding heart disease and heart-related medical procedures.